So we have some participants in our group like who have been diagnosed with PCOS. So they're wondering what are the things that they can do, like what lifestyle changes or what measures might help their condition.
So could you also, briefly for our listeners, just explain, like, what is this PCOS and how is the lifestyle connected?
Yeah.
So PCOS or polycystic ovary syndrome is, like I said, the most common hormonal disorder in young reproductive aged women. And what it means essentially is that a woman has irregular menstrual cycles or irregular ovulation, right? So a woman typically should have, a young woman should have a regular menstrual cycle. We used to say it's connected with the lunar cycle. So, 27, 28 day, but anywhere from 21 to 35 days, whatever is that woman's, cyclicity. But in this case, women may not have a menstrual cycle for many months or even years, right? And the other problem that they have here is excessive male sex hormone or androgens in their blood, which we can measure on a blood test, or they have symptoms from it, like they may have hirsutism or facial or body hair, unwanted body hair, or they may have male pattern hair loss from the temples, or they may have acne, like pustular acne. So all of those can be signs of like androgen excess or male sex hormone excess in a woman's body. And those two are hallmarks of PCOS. It's called PCO or polycystic because there are very frequently, although not always, tiny cysts, like really small, multiple cysts on both the ovaries. And what causes this condition is very complex, but to make it short, it's insulin resistance, or what we keep hearing, metabolic syndrome, right? So in these women, they have a genetic predisposition where their body is very resistant to insulin. And what that means is a certain amount of insulin is present in the blood, but the cells, the muscle cells, the liver cells are not responding to that insulin. And they are, insulin is saying to the cells, okay, get the glucose in. But basically the receptors are not opening up and not letting the glucose get in. So these women may have impaired glucose tolerance, or they may have slightly high sugars, right? And this condition is very, very environmentally controlled. It's genetically inherited, but environmentally and also, controlled by metabolic factors, nutritional factors, toxin exposure, and so on. But as is the case with insulin resistance, the lifestyle controls it, or really, determines how it will get manifested. So I'll tell you a case in my practice. This is an actual, patient in my practice who had come to me in her early 30s, and she had had one child. So in her late 20s, she may have been diagnosed with PCOS, and her body weight after her first pregnant, she couldn't get pregnant. She had required fertility drugs that did not work out, and then she underwent in vitro fertilization, and with that, with the second one, she was lucky and she was able to have a child. But when she came to me, she had been 268 pounds. And her testosterone level, which is the male sex hormone that we were talking about, was quite high. It was 51. And in a normal woman, it should typically be 6 to 45, but most women are less than 25. And we repeated it, it was still high, 79 or 80. So she, we began her on metformin, which is the drug we use for PCOS to sensitize their body to the insulin. But she also did lifestyle changes. So she stopped eating processed foods. She stopped eating all the white flours, white breads, etc. And she went on a decent exercise program, just 30 minutes of, regular exercise, nothing crazy. And she, within 1 year, her body weight was down to 180 pounds. So she lost 80, 90 pounds. And her, testosterone went down to 17. Now, before she started this, her insulin levels were 7.9. And we say, anything above 8 is a high fasting insulin. And her glucose, was okay, 87, but, with that high fasting insulin. So she had insulin resistance. And now her insulin went down to 2.9 and her sugar is down to 78. So her insulin resistance score is now 0.6, which is extremely insulin sensitive.
That's amazing.
And the most important thing is she got pregnant on her own, right?
Yes,
She
that's
did not
amazing.
need
Yeah.
the drugs this time or the in vitro this time. And PCOS is one of the most common and one of the most easily treatable causes of women's infertility. It's actually quite, I think it's an epidemic in India right now, you know, the
It
amount
is.
of infertility in young women. So just, you know, obviously we gave her metformin, but like you said, Arjun, it's, a co-drug. And I think, you know, just metformin could not have explained the 90-pound weight loss. She did her due diligence. She did her hard work, and she was able to have a successful pregnancy. And, you know, she was on drugs to control her acne before. It's a drug called spironolactone. And she came off of it. Her skin is fantastic because her testosterone levels are now normal. So this is what lifestyle can do in many cases.
I'm so glad you brought this up, Mahima, because we had a similar participant in the course. And the first words that she spoke to me, she said, like, I wish I can be a mother. Like on the first day of workshops, she was literally in tears and she said, I wish I can be a mother. And through the 3-day workshops, she learned about the lifestyle changes and she implemented that. And actually, 1.5 years later, we came to know that she was pregnant, and we were so overjoyed for her. Like by, as you said, by changing the lifestyle measures, and like by reducing her weight and eating healthy, going for a whole food plant-based diet, she was able to like take care of that condition.
Yes. Well, actually, I don't want to come across. I feel like I'm making, like, you know, weight a big central portion of my story. So even 5% weight loss, we have done studies. You know, there are numerous studies. PCOS, thank God, it's like the lifestyle studies are there, unlike thyroid, you know, because there's a lot that we have studied, meta-analyses and systematic reviews on women with PCOS. And, you know, studies show that 5% weight loss can lead to regularization of menstruation and pregnancy outcomes. So people don't have to feel like they have to lose a huge amount in order to be able to get pregnant. Just a modest amount is, 10, 15 pounds if they are looking at like, you know, somebody who's above 200, 250 pounds, or even less than that. Anything healthy, anything that moves you in the, you know, the healthier direction, it can actually bring back fertility very easily.
That's so good to know, because most of the time, many of our patients think like, you know, they have to have perfect health rather than just moving towards the being the healthiest version of themselves. Just 5 to 10%, even 5% of weight loss is good for PCOS. Similarly, for even in, you know, type 2 diabetes that we
Diabetes,
see.
absolutely.
Yeah, just
Yeah, the direction is more important than the speed.
yes. Yes, direction is
You know,
yeah.
because you don't want to be going backward.
Yes. And sometimes, you know, many of our, you know, students that we work with, our patients, they want results happen now. Like you mentioned, the direction is more important than the speed. So that's when we come back to the mindset. Hey, you know, when we start making these changes, the results will happen. So
And that's, you know, that's actually very important for fertility, because, you know, women, when they start doing, oh my God, I have to track my ovulation, I have to be on a, you know, we have to be on a calendar here. And, you know, when you do that, that's when it becomes a problem. Stress is a big important issue for fertility. And when you're just laid back and you're like, you know, relax and you enjoy, you know that the joy is more than what you're giving up, that's when pregnancies happen, right? So stress is big for fertility. So the last person I want stressed out is somebody who's trying to have a baby. They should not stress it.